The United States is banning all imports of Russian gas, oil and energy. The move's just been announced by President Joe Biden. It follows a swathe of other economic sanctions to punish Russia for invading Ukraine. Biden says it will deal another blow to Russian President Vladimir Putin's war machine. He says it has strong bipartisan support in Congress and the country.
Americans have rallied to support the Ukrainian people and made it clear we will not be part of subsidizing Putin's war.
The UK is also phasing out Russian oil imports by the end of the year. Meanwhile, our government's being called on to offer Ukrainian refugees a safe haven. The United Nations Refugee Agency reports more than 2 million people have already fled Ukraine since Russia invaded. New Zealand's offering a 12-month extension for Ukrainians here, whose visas are set to expire by the end of 2022. Ukrainians offshore with a visa can also now immediately fly in. Amnesty International Aotearoa's Meg Durand says we must also introduce an emergency visa for people seeking safety.
New Zealand has a refugee quota of 1,500 a year, which hasn't been filled for the last 2 years due to the COVID pandemic. So really, we've already fallen well behind.
Changing rules to allow COVID-positive health staff to work could worsen burnout. The Health Ministry's issued the change to allow staff to return to work early if their absence means the service couldn't run. It allows staff to leave isolation on day 6 if they test negative twice, and if they still test positive, work only on COVID wards. But a union says 80% of senior doctors already routinely work through illness. Association of Salaried Medical Specialists Executive Director Sarah Dalton says this could make matters worse. A suggestion more rapid antigen tests may be in line to get the tick of approval. Currently, 11 different types of rapid antigen tests are able to be used here. Director of Public Health, Dr. Carolyn McElnay, says we have a process in place for approval and that's been recently reviewed, in particular looking at the criteria for approvals. And she says on that basis, the Ministry of Health has gone back to a number of distributors asking for more information.
And if that information is acceptable, then likely that we will be approving more.
Local councils could still have a voice in the Three Waters reforms. An independent working group of council and iwi representatives has recommended a public shareholding structure to maintain public ownership of drinking water, wastewater and stormwater services. Councils would own all shares in the new water services entities on behalf of their communities. Not everyone is convinced by these recommendations. Many councils like Timaru, Waimate and Mackenzie in Canterbury insist they'll do a better job with water services than the proposed mega entities. Harmful drinking has been linked to a heightened risk of suicide. An Otago University study has found alcohol abuse or dependence almost triples someone's chances of considering suicide. 21% of adults meet hazardous drinking criteria. Despite this, the National Suicide Prevention Strategy doesn't specifically target the risk factor and it has zero alcohol-related interventions. Study lead Dr. Rose Crossan says the findings reveal the need for urgent change.
Alcohol use disorder increases risk above and beyond those other common risk factors, things like major depression or anxiety or relationship dissolution or employment status.
Thanks for checking out our YouTube channel. To stay up to date with all the latest news from the New Zealand Herald, click the subscribe button below or check out one of the videos here and head over to nzherald.co.nz for more details on these stories and more.